this computer. All right.
All right.
Hi, this is Steve Henson with the Prostate Network. I'm a 12-year survivor and our co-founder, and I'm here with Dr. Shen.
Good evening. I'm Xingli Shen. I am a radiation oncologist. I've been in practice about 10 years. I treat primarily prostate cancers. I'm really excited to talk with everybody tonight.
All right, so this is where everybody can submit questions throughout the next month or two, and every couple months we're going to sit here and field questions. It can come from doctors, researchers, survivors, spouses, anybody. So I believe you got the first question that for us tonight here.
Yeah, Steve, great. So, you know, as a prostate cancer survivor and a patient, I was wondering what did you what do you wish you had talked to your doctor about, or questions you had asked your doctor before you started treatment, but didn't know to ask at that time?
Yeah, so I posed that question at our meeting last month, and our guys had all sorts of really good ideas. Um, One of the biggest ones that everyone was about was experience. One of the guys, he was an electrician, and he's like, every time I go on a new site, on a new project, the guy's like, hey, before I give you my money, how many of these jobs like this have you done? Can I trust you to do it? And he's like, I didn't ask my doctor if he could figure out how to make my body work again. And so they wanted to know about, experience and specific to what they were going to do. Second opinion was another one where I think a lot of them had been a little hesitant. They were afraid they were going to hurt somebody's feelings. And we all know now that after you make it through, that everybody wants the best for everyone. And getting second opinions, if that's what you need to get comfortable, is super critical, because getting comfortable with your decision before you pull the trigger is very key. They wanted to know about diet. They didn't ask, because this is a reflection point for these guys where they need to make change. And after they made it a little way through, they realized, hey, I had cancer. I need to make some changes. And so at that point, when you get diagnosed, you're trying to figure it out, that's a good time to ask about, diet and things like that, because it's a really important possible turning point for people, when you hit that kind of crisis. And then the other one that they really wanted to make sure guys always asked was about side effects with the incontinence and the ED. If you don't talk about it, it may not come up, and it's really key to have those conversations. So that was it. So the next question I got, it's from a long-term hormone guy. I'm just going to read it. I've been on hormone therapy for 11 months and will be on it for at least a total of 18 to 24 months more. I've gradually lost a little weight, 15 pounds, mostly muscle. I was advised to do some simple strength training to dull the effects of losing muscle and experience more fatigue. It happened slowly, and I did not. Did not do what he was supposed to. Is there any recommendation program to combat hormone therapy effects? Yeah. And why is it prescribed for such a long period of time?
Okay, that's a really fundamentally important question. And those are two questions there. I'll tackle the first, the training. I think I generally tell my patients that on hormonal therapy that I want to see them do some strength training, but also some cardiovascular, like aerobic exercises. So the strength training is because you're going to lose muscle, right? As part of the not having the testosterone, and so you want to try to preserve muscle as much as you can. And so it's never too late to start. I think it's good to do some stretches, and so you don't want to pull anything, but to do some weight training, ramp up to as much as you can do. Some people, if they have the resources, maybe get a physical, like a trainer. Sometimes we can do some physical therapy. But I think building that muscle, keeping you from losing that lean muscle, is really important to the recovery afterwards. I think aerobic exercise is also important. You got to remember, hormonal therapy slows down your metabolism so that all these cardiovascular factors get worse. Um, One of the things, for instance, is if you have a pre-existing heart condition, right? Like if you had a heart attack, stroke, your diabetes are controlled, you're at risk for getting another heart attack. And so um, doing some of the aerobic exercises can help counteract some of those metabolic effects. So I think both are really, really important. And if you need to get somebody to help you do that, then I think that's a worthwhile thing.
Great advice.
Uh, as far as how long, why we choose the duration of treatment that's there, for the most part, um, uh, we all of this is based on clinical trials. Studies that shown, okay, for X condition, you have to do this duration of hormone therapy. It sounds like for this particular question, this patient is on long-term hormonal therapy. And that is, and I'm guessing the situation here, but my guess is that this is a person who has high risk prostate cancer, getting radiation and hormone therapy along with it. Well, how that duration came about is because back in the day, we tested, 6 months versus 0 months, and 6 months was better in terms of survival. And then later on, people tested 36 months versus 6 months, and 36 months was better. And then people tested 18 versus 36, and 36 was still better, but not a tremendous amount better, and had a lot of a lot more side effects as you went for longer. So for a patient with high risk prostate cancer getting radiation, the current recommended duration is between 18 to 36 months. Um, but the bottom line from, where that came from is people have done a series of clinical trials, and those are the numbers that were determined to be the optimal ranges. For each individual person, right? There's a certain amount of skill and I don't want to say art, but skill to figure out what makes the most sense for that person in terms of, well, more side effects versus higher cure rate.
Yeah, yeah, it's amazing how complicated humans are, isn't it?
It is, and
Yeah,
hormonal therapy is such a um, affects people differently,
yeah.
and so it's hard to know from the beginning how well somebody's going to handle it.
Thanks for those insights. Okay, a couple of, I think these are fascinating questions.
Mhm.
Um, is GAINSWAVE a proven ED treatment for prostate guys?
So that's a really great question because ED, like I talk about ED with patients a lot, because that is one of the complications of treatment. No matter what you do surgery, you do radiation, hormonal therapy, combination. It's one of the quality of life, problems with prostate cancer treatment. So I'm not disclaimer, I'm not an expert at erectile dysfunction, but I did, kind of look up the Gaines wave and how it works. And the way it works is by breaking up some plaques in the blood vessels and hopefully improving blood flow to the penis. Um, so um, the um, there's some data that the this technique and this device um, can help ED in patients who have ED because of natural processes, right? So because of aging, because of plaque buildup as you age. Um, I did not find any data in uh, this device helping patients who have ED because of treatment for prostate cancer. It doesn't mean that it won't work, but there's no data for the success in patients who had prostate cancer treatment. My thinking on if the ED happened after surgery, the mechanism of ED after surgery is the nerves are injured. And because the way this works, I don't think this would be expected to help people with ED resulting from prostatectomy, from surgery, because that's more of a nerve thing problem rather than a blood vessel problem. For patients who have ED after radiation therapy, I think theoretically this could help, but again, there's no real proof or data that tells you that it would help. Um, I don't think it'll hurt anybody. This is safe. It's FDA approved. By the way, we talk about FDA approvals. I want to say the FDA approval process for devices is much, 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 much lower threshold that you have to meet than FDA approval for a drug. So this is a device. So yeah, it's safe. Um, but I just don't know. I don't think there's any good data to say that if you have ED after treatment for prostate cancer, that this is, proven to help. It's not going to hurt. Maybe it might help, but we just don't know.
Excellent. Similar down at, I think this is even more interesting is,
Yeah.
and I don't know how to pronounce, is EMSELLA.
Yeah.
It's abbreviation for something. Pelvic floor stimulation, a proven incontinent treatment for prostate guys.
So again, this is very similar kind of to the other question, right? It's how do we use technology to make quality of life better? And so this particular device is again, it's FDA approved device for incontinence. What I was able to find is that well, the way it works is it stimulates the muscles down in the pelvic floor to do contractions. It's basically like doing Kegels for you. Um, we know that doing Kegels or pelvic floor therapy to strengthen those muscles, other techniques to strengthen those muscles, helps with incontinence. We know that. And if a patient has not gone through that and they're having some incontinence, I recommend them to do these exercises that you can do, on your own. Um, how much this sort of electromagnetic stimulation of those muscles can add on to Kegels or physical therapy when that's not working, don't quite know. This seems to help women who have incontinence as they get older. So for the guys, and I think some guys may not be aware that women as they get older tend to get incontinence after they have some babies and their pelvic floor muscles are weaker. So this device seems to help the women. Very early data, but seems to help the women with incontinence. Will it help men too? Possibly. And you'd think that the mechanism is similar, um, but again, not necessarily proven in men after prostate cancer surgery. And I think one should try physical therapy and some of the proven methods first.
Yeah, physical therapy. Everyone that I've spoken to, and I spoke to a lot, everyone who's tried physical therapy is swearing by the benefits of it. Just a little bit, because they just don't know what they don't know, and
Yeah.
those physical therapists are great teachers. Okay, so here's I think a loaded question here. Does exercise trigger more testosterone, which is bad for PCA guys?
Um, so I would say that exercise is pretty much always good. Um, so um, so the scenarios where you
Yeah,
run
I
into
know the guy who asked it. He was
yeah.
trying to get out of this, going to the gym.
So right. So I think that the situations, right, where like you might so if a patient is on hormonal therapy, right, if a patient is on treatment to purposely lower the testosterone, no matter how much exercise you do, you're not going to overcome the medication to suppress the testosterone. Um, in terms of improving raising the testosterone level. Um, so and besides, like we talked about earlier, the exercise has really great benefits for uh, improving your muscle, maintaining your muscle mass, helping your cardiovascular system. So definitely, if you're on treatment, there's no question you should do exercise. Um, in terms of afterwards, right? Um, you know, the treatment, the hormonal therapy durations for a certain period of time. And once that is over, being in that low testosterone state doesn't really help you. So I think the little extra bit of testosterone you might gain by doing exercise is really not expected to hurt the cancer whatsoever.
Yeah, I will make sure he knows he's got to go work out. Does having a vasectomy have anything to do with getting prostate cancer?
I think the short answer is no. People have looked at this and no.
No.
Um, I think there's maybe you know, you can create a scenario, right, um, where maybe you can come up with a mechanism but the short answer is people have looked at this, no.
Yeah, science has proven it. Yeah, no. No excuse, guys. Well, thank you so much for this, and I really look forward to recording these with you, and I can't wait to see what
Yeah.
the future questions come in for our guys. So thank you so much.
Thank you so much, Steve. It's such a pleasure to talk with everybody. And I think like I really also enjoy like some of this back and forth, right? Like I think it helps me, right? When I get say, when you tell me, oh yeah, these are the questions that men don't always remember to ask, that helps me to figure out like, well, maybe I should bring up some of these things, because that might help the patients feel more comfortable with their treatment.
Yeah, I think this is just a great way for anyone out there who's watching right now who has a question, or
Yeah.
sometime next week they randomly think, hey, I got a question. Well, here's a mechanism that can feed them right in here, and we can try to help them. So thank you for all you do.
Absolutely. Thank you, Steve. You have a great night.
Bye.
Bye bye.